Thank you for having me. Good morning, everybody. Well, I know it's the afternoon there. I'm actually in Colorado today. We have a national food and nutrition conference in Colorado this year in the U.S. And so I am sitting in my hotel room, and I was awaiting eagerly to speak with you all. So thank you so much for having me. Just a little bit about the objectives of the next 30 minutes. I'm going to share the mission and vision of New York City Health and Hospitals, describe a bit about the growing partnership between health and hospitals and Sodexo, share a little bit about the history, explain the process behind how we deployed this initiative, and discuss some marketing strategy, and of course, share some results. So New York City Health and Hospitals is the largest public health system in the US. We are comprised of 16 facilities, 11 of which are acute care facilities, 5 are post-acute, a combination of LTAC and long-term care. We have over 70 plus locations, including diagnostic centers. We provide over 1 million New Yorkers care despite their ability to pay, and we employ over 40,000 healthcare professionals. I think what's really important in sharing this with you is that if you've never visited New York City is really a melting pot of so many different cultures and populations. So in one of our facilities in South Brooklyn, we may have one culture or population as the majority of our patients, but in the Bronx, which is another borough, we may have another. And this has played a really important role in designing our menus and making sure that we're providing our patients with food that is not only good for them, but that they're going to enjoy. So I'm not going to go into much detail about this. These are the overall mission, visions, and values of New York City Health and Hospitals. As I mentioned, we are a public health system, so we do provide care despite anyone's ability to pay. Some of the pillars that we're really built on are around social and racial equity and making sure that we're providing patients with the best possible care despite any sort of outside socioeconomic factors. So Sodexo really started our partnership with Health and Hospitals back in 2005. So our partnership has grown over the years exponentially, quite frankly. Really started as a seed. I love using this analogy, right? And developing into a fruit. And we've really utilized our clinical expertise, our operational expertise to identify and improve on any inefficiencies that may have been occurring within the food and nutrition operations. We've also, of course, invested in talent and equipment to ensure that we were always equipped to develop out programs quickly, swiftly, and in the most efficient way for our New York City Health and Hospitals clients. So this journey that you're really interested in hearing about really started back in 2019, with then Brooklyn Borough President Eric Adams, who is now our New York City mayor. And at that time, he requested hospitals to sign on to a Meatless Monday pledge. Our CEO at the time, and currently our CEO, Dr. Mitchell Katz, who is also a primary care physician, had endorsed this pledge and really supported us in starting the Meatless Monday program in all 11 of our facilities. And I'll just, as I go through the program, I may repeat a few things, but what's important to also understand about how our system runs is that we really try to standardize as much as we can. So we have one menu for all 11 facilities. And that's why the cultural diversity, in which I started to speak about in the previous slide, is really important to take into consideration. So starting in January 2019, every Monday we had a meatless choice as the chef's recommendation. We did start out, all of our options at that time were vegetarian, lacto-ovo vegetarian. So we were providing dairy and egg as part of any meal. And some of the dishes that we started out serving were garden bolognese, a 3-bean chili, a chickpea stew. And these were all dishes that were really thought out in being familiar with our patients. Most of our patients are very familiar with your typical bolognese, which is made usually of some sort of meat base. And chili is usually a beef chili. So we're starting to do those protein swaps very early on back in 2019. Something that had the same flavor profile that they were familiar with, but we could easily swap out the protein. And in the beginning, and thank goodness we had the wherewithal and the thought process at the time to start really tracking our acceptability from then, because that really became the baseline in which we were able to build on our program. So we did look at the acceptability of those items, and we had an astounding, 97%, over 97% acceptability rate at the time. Fast forward to 2021, we knew that the political arena in New York City was changing, and Eric Adams was very engaged in the political process. We also knew that he was likely going to become the New York City mayor, which we were really excited about. But we also knew what was right for our patients, and we saw the research that was out there, and we saw what the acceptability and the wonderful results that we had from starting our Meatless Monday program. So in November of 2021, and I'll talk a little bit about the timeline, we started to build on our Meatless Monday program and really develop the strategic pillars, for developing what is today our plant-based healthy initiative. So the pillars consist of the science, the innovation, the engagement of our patients, and engagement of our communities, of course. And it was also really important that we looked at where our food is being produced. So as I started to explain, our food is produced out of one culinary center, and we have one standardized menu for all 11 of our acute care facilities. The culinary center is located in Brooklyn, which is one of our many boroughs, and it is cooked and chilled and then shipped on a daily basis to all 11 of our hospitals and our 5 post-acute care facilities. It was very important that we looked at the infrastructure, the management, the human resources, the processes at the culinary center to ensure that as we started to go on this journey, we were going to be able to really support the change that was about to occur. So let's talk a little bit about the timeline. As I mentioned, really in November of 2021, we started to put together a really robust action plan around how we were going to expand on our Meatless Monday program into what is today the plant-based default program. And I have just referred to it as default, but what I will say is that we never refer to it as a default program as we're speaking to our patients. When we presented to leadership, our stakeholders, we refer to it as our chef's recommendation. And we don't want to point out the obvious. We want to make sure that people understand why we're doing this and really understand that the food is delicious and nutritious. And that's why we're putting our best foot forward in our hospitalized patients. So we decided to really roll out this program in March, which is National Nutrition Month in the US. And this was a great chance for us to really engage further. We usually have a lot of events in all of our facilities around National Nutrition Month based on whatever topic the Academy of Nutrition and Dietetics has chosen for that year. But this was a real good opportunity for us to really put together lots of programs to speak about the plant-based initiative. So on March 1st, we rolled out our default, I'm saying default now, but our chef's recommendation plant-based menu for all 11 of our facilities. And we started with the lunch meal to get a real good pulse of how our patients were going to take to this program. And from the beginning, we also identified any metrics that we were going to track so that we were able to really, although we had the baseline from Meatless Monday, we have now sort of expanded, not sort of, we have expanded the program even further. So we wanted to make sure we had the baseline data to then build off of and identify further outcomes in the future. Further on down the line, and I'll talk a little bit more how we implemented the program in a second, but further on, we moved on to phase 2, which is when we expanded the program even further into our full-on patient dining experience. So we implemented our food service associate program, which is really a program in which food service associates, their jobs are to solely visit our patients, take their orders, deliver their trays, visit them after their meal, get feedback from them, determine if there's anything else that they need for that meal period, and then do it again for the next meal. So it is a real closing the loop approach to the patient dining experience, and as close to a restaurant style dining experience as you're going to get in a hospitalized or institutionalized setting. We have now moved into further phases of the program where we're starting to introduce these delicious plant-based menus to our post-acute care facilities. It is not a default in those facilities, but we are introducing them as specials, and we're bringing them to resident councils and really showcasing the delicious flavor profiles that our culinary team has worked on. And then lots, of course, to work on in the future, including partnering with community-based organizations and really making sure that we're looping in the community so that there's a true continuum of care when a patient is released back into the community and home with their families. So let me just step back for a second. On March 1st, we launched this program. And if I could just explain the process. So within the United States, and it really goes state by state, when you come into a hospital, a dietitian does not have the right or ability within New York to write a diet order. So a physician will prescribe a diet order, and based on that diet order, it will then be entered into our electronic medical record. Our electronic medical record will interface with our nutrition software, which then, based on logic and algorithms, will spit out whatever menu for that day is appropriate for that patient based on your diet. We have programmed our menus so that the first choice and the default or the chef's recommendation for the majority of any diets in our facilities, and I'll speak about the ones that may not be eligible, are plant-based. If you do not like your plant-based offer that's offered to you by our FSAs during as the chef's recommendation, you were then offered a second plant-based choice. So we're really leaning into the science of nudging people to make that better choice and having to ask for something that is not plant-based as opposed to the opposite, which is what I think most of us are used to. Usually if you go to a restaurant and there's a hamburger on the menu, if you want the veggie burger, you have to ask for the veggie burger, as opposed to the veggie burger being the offering and you asking for the hamburger. So we've really made that swap and are not forcing, but gently encouraging people to ask for something else. But I will say that no matter what, ultimately they do have a choice. So if a patient does not want the first choice, which is plant-based, or the second choice, we have a slew of other options that are plant-based as well, or not plant-based. So what's been really important for this program is getting the word out to all of our stakeholders, our nurses, our frontline employees, our food nutrition employees, our environmental service employees, everybody, to be able to speak about the importance of a plant-based diet, what it could do for your health, what it could do for your environment. This is just an example of one of the screensavers that we had and still have on our computers throughout all of our facilities that has a beautiful picture and really speaks to, in very simple terms, what a plant-based diet has been shown to do. Let's get into the delicious stuff, right? So here are some real live pictures of some of our dishes. A red curry vegetable, a zesty jackfruit burrito bowl, a garden bolognese. What I would point out to you in this slide is notice that nowhere in the naming convention of these dishes do we point out that these dishes are vegan, nor do we point out that these dishes are plant-based. We simply are describing the ingredients as they are, and letting the patients, taste them for what they are, not for the fact that they are plant-based or vegan. And our dishes are all vegan. Our center of the plate options are all vegan. We do not use any dairy or egg. My favorite dish is not on here, but the other thing I would also point out are the vessels in which our dishes are served. So these are actually china bowls and plates, and these are the vessels in which our hospitalized patients get food. So again, this is really helping to not only to hold the heat so that they're getting a hot meal, but really to elevate the entire patient dining experience. Ultimately, I'm a dietitian, right? Ultimately, we want our patients to eat. So it's great that we're delivering this option to our patients. It's great for their health. We know the health benefits out there. It's great for the environment. But if they're not enjoying the food and they're not eating, it really defeats the purpose. So we've really looked at this from a holistic approach to looking at the entire experience from the patient bedside. So just to reiterate the different steps in which our patients will choose their meals. So a food service associate will come in and speak to our patients. It is a spoken menu. They do not have a paper menu where they circle and then hand back. Everything is loaded on the iPad, and then everything integrates and interfaces from one system to the other. The chef's recommendation is offered again as the alternate, and we always have menu options available that are plant-based and non-plant-based. And the important piece of this is that the food service associates will then round back to obtain feedback. And they do this with every meal. And this has been really important because this has really given us the data that we need to either show that our patients are actually accepting this dish, but also for our culinary teams to really be able to dial in on any dishes that our patients don't like. So this information on the bottom right hand of the screen, you'll see a screenshot of the platform that we use called Experiencia, in which we are able to get this information very quickly, do a root cause analysis. If we're able to see if our patients are giving these particular items a thumbs up or a thumbs down, a good rating or a fair rating, and then we're able to then aggregate that data and then give the feedback back to our culinary team to be able to make any changes. And in the beginning of the program, we were really able to do this. We did do this on a daily basis. We had meetings daily with our culinary teams to adjust flavor, to adjust spice. Maybe something was too tomatoey, or they needed, some sort of other flavor or spice within it to really satisfy our patients. The other piece that was really important prior to the March 1st launch was getting the word out at all levels of the organization. So these are pictures and some collateral that we have developed, in which we went around to each of our facilities and we presented this program to C-suite, so CEOs, COOs, frontline nurses. We had tastings for them as well. We went around on the nursing units and we shared the food with nurses. We know how valuable people's time is, and we wanted to make sure that they didn't have to come to a conference in order to hear about the program. We took it to them. We also developed buttons, which you'll see at the top left hand of the screen, which people still wear today. We really want to open up the conversation about plant-based. We want people to ask why, and we have the answers for them. We had a plant-based recipe contest to engage staff. And again, remember the capacity in which we're doing this. We're doing this at 11 facilities. Our largest facility houses about 800 patients, and our smallest is about 90. So we really range in size and acuity. And so we're really able to get the word out, on a very large scale. The middle screen is a picture of our Dynex trucks. So the other unique thing about our system is that we do not cook, as I mentioned, the culinary center, we do not cook anything on site. We do not have kitchens in any of our facilities. And if we do, it's very minimal kitchen equipment. As mentioned again, all of our food is cooked off-site and shipped, and then our food is rethermed in these Dynex trucks. And what we have done is we wrap these trucks in these beautiful, my backgrounds as well, in these beautiful pictures, again, to really just get the word out there and start the conversation and engage people. These trucks are being pushed down our hallways before they get to our patient units. So families and anyone who is visiting, it may just spark a conversation or a question, and that's what we want to do. And then we have some pictures of our conferences. We called it a road show, where we went around to all of our facilities and presented the program. And this was still in the middle of COVID, or towards the end, I should say, actually. Some more collateral that we developed, of course, patient education, an FAQ, simple questions that we could hand out to people. Why a plant-based diet? How do I follow it? What's the simple way to get started? This information is available to all of our patients and our employees. And additional collateral, of course. The other piece that's been important, I love the middle collateral that you see, the middle piece of education material that you see is just a blow up of the one on the left. But it was important that our dietitians were able to point out to our patients the micronutrients and macronutrients and where they were getting them within the meal. So, you're getting your vitamin C from this food and this ingredient, you're getting your potassium, you're getting your antioxidants. We really wanted, again, to use this as an opportunity to educate our patients. Our patient populations do not have a lot of nutrition education prior to coming into the hospital. This may be the first and, quite honestly, only time, we hope the only time, that they have an interaction or have the ability to be educated by a registered dietitian. And so we want to make sure that we are piling on as much information and it be digestible and something that they could really take home with them. The other really crucial piece, and I cannot say enough about having leadership support, not only at your facility, but if at any possible at a government level. This is a picture of our New York City mayor. If you have never heard Mayor Adams speak about his own personal journey with his diet and his lifestyle habits, I encourage you to Google him. He's very inspiring. He goes around, he shares his story and his mother's story about how he changed his diet to a predominantly plant-based diet and has now put his diabetes into remission, is no longer on any medication. He lost a ton of weight, and obviously his overall diet, he started exercising. So I think it's really important to identify any political stakeholders within your government sector, and of course leadership at the organizational level. But I don't know that we would be as successful as we have been if we have not had the support of Eric Adams and his office. As a public hospital, we report up to the mayor's office, so we work very closely with them on policy within the city. So having his support has been completely invaluable. I can't say that enough. Partnering with other organizations. So we've partnered with the Better Food Foundation, Greener by Default, and really utilizing social media platforms to help tell our story and to share how we have had such great success within our hospital sector. So this is always what everyone's asking for and waiting for, right? The results. What have we done? And what are we hoping to do? So we have tracked all of the metrics. The metrics that we look at are acceptance, satisfaction, and of course the carbon savings. And we also look at uptake. So let me define these a bit for you. Acceptance is a very simple number. It's patients that choose a meal and don't ask for anything different. Uptake is digging into that number a little bit more and looking at the total amount of patients that are eligible for a plant-based diet and choose that and then don't ask for something different. So the denominator is a little bit smaller. Now, when we've worked with organizations like Greener by Default and Better Food Foundation, we did work with them to develop our target. What were we, what was our goal? What were we aiming for? And what we were told was that from an organizational standpoint, from an institutional standpoint, the goal was 50 to 60%. And from the beginning, we were at a 50% goal for uptake, which I'm really, really proud of. We continue to track these numbers. Of course, they ebb and flow, but last week we were still at 52% across the system. So we also look at satisfaction, which, as I mentioned earlier, really digs into the individual satisfaction of particular dishes so that we're able to take things off. On September 11th, we just did a complete revision of our menu and we removed items where that satisfaction number was not as high as some other numbers. So it's really important that we continue to track that so we're able to make those quick adjustments and keep our patients satisfied. I'm really also proud to share our carbon savings. So our team looked at our total purchases of food from 2021 to 2022 and then 2022 to 2023 respectively, same time frame, and we were able to show a 36% reduction in carbon just in our food spend and purchases. So I mean, I was sort of flabbergasted by this number. I don't know that we're going to continue to be able to add such high numbers to that to that metric, but we're going to continue to identify areas in which we know that the carbon footprint is high and see where we can continue to drive that savings. Cost savings. This is also a big question and I think a bit controversial at times. I think when we all think of plant-based dishes, typically we think of frozen food items that could be very expensive and costly to the consumer. But we have been very conscious about using whole food plant-based items that are not frozen, that are not prefabricated. In fact, our garden bolognese, when we started back in 2019, we started out using a soy crumble. And today we don't have any soy products in that dish. We have only mushrooms. So mushrooms and lentils, I should say, it's a mix. So we really have taken great pride and thought in making sure that our dishes are as whole food as they could be. And this has resulted in a savings when you are comparing animal protein to plant-based protein center of the plate. So at the beginning of this initiative, we did see a savings of 59 cents per tray. Supply chain over the last couple of years, obviously, has ebbed and flowed. But as we continue to trend that savings over time, we do see that no matter what, when you are comparing a beef dish to a plant-based dish that is not a pre-made frozen product, it is less costly. So I don't have people always ask what's the total savings, and that's a bit of a tricky number to come up with because there is initial investment that has to be put in the beginning. We did invest in our equipment. We did invest in our resources. But when we're comparing center of the plate animal protein to plant-based protein, there is a savings, and we anticipate that in the long run, there will be an overall savings. To date, I think the last number I saw were in the 600s of serving plant-based meals, and we still are on track to serving over 800 plant-based meals for this calendar year of 2023. So just to conclude, some keys to success. I can't really stress enough how important it is to identify and partner with key stakeholders, getting buy-in from employees at all levels. We want to make sure that employees at all levels can really tell our story. This is not a dietitian-driven only initiative. This is a food and nutrition initiative. This has to really come from the chefs, the cooks, the dietitians, the people serving the food, our food service associates. We all have to be able to explain, basic why as to why plant-based food is better for you, why our patients should try it, why it's better for our environment. Making sure that you have the culinary talent. Our team has been so innovative in really taking recipes that we know our patients like, pulling them apart, and then rebuilding them with plant-based ingredients and whole food ingredients that are less costly, better for you, and better for the environment. Focusing on planning and development. So making sure that you take the time to really put together an action plan. We rolled it out rather quickly. I do wish we had some more time to really dig in to the baseline data. Looking back, hindsight, I would have liked to have some more baseline data to be able to really show the great success that we've had. But it's been really important to have that continued focus and planning on how we're going to take this program to the next level. Trialing dishes before the patients, before we put it on the meal, so on the menu as a standard. So we did do that starting back in November when we started to plan our program. We identified dishes that we were going to put on the menu, and we rolled them out as patient specials. And we got feedback before we invested in buying the large quantities of lentils and different types of legumes that we knew we were going to have to. So we wanted to make sure that our patients liked it. Again, none of this works if our patients are not consuming the food. I talked about the collection of baseline data. So important to be able to show success and where you may need to make an adjustment along the way. And don't be afraid to start small. I think it's important that any change is good change. Hospital food typically has had a really bad stigma around it. In the US, it has not been something that people looked forward to when they're in the hospital. And there are very few things that people can control while they're in a hospitalized setting, and food is really one of them. And we want to make this experience for them, their dining experience, really enjoyable. We started out with Meatless Monday. We then expanded to our plant-based default meal at lunch, and then we expanded to dinner over time. So again, starting small, there's nothing wrong with starting small. We are now in the midst of adding, more plant-based dishes on at breakfast. So if we could do it as the largest public health system in the US, anyone could do it. And I encourage you to take a step in that direction. Thank you so much for your time.